You probably have to click the little button that says you're being recorded. And we are live. Good evening. Thank you for joining us for another edition of Jeffco Health Matters here on the Jefferson County Health Department Facebook page, where we talk about matters of health that matter to health. This evening, we're actually going to be talking about flu season. As we know, we're kind of right on the cusp of flu season. So we're joined this evening by Sara and Sara, who have both been on our show before. Sara, our epidemiologist, is in the green shirt, and Sara, our nursing supervisor, is in the gray sweater. So ladies, do you want to quickly introduce yourself and what you do here at the health department?
Sure. I'm Sara Warnicki. As Brianne said, I'm the nursing supervisor for the health department. So wear a lot of hats. I've been here about 14 years, so been through quite a few flu seasons and given quite a few vaccines.
Awesome. Hi, everybody. I'm Sara Wilton. I am the epidemiologist here at the health department. Many of you probably know me from COVID-related stuff. I do a lot with the COVID reporting and response team, but I also work with a lot of the other conditions that we have in our community with our other public health nurses.
Awesome. Thank you again, ladies, for joining us this evening. So kind of as we just mentioned, we are on the cusp of CDC's official flu reporting season. I think we start reporting in week 40, right? I'm gonna say right, Sara, but both Sara. So.
Yes, that's correct.
Yeah, so let's just kind of start with the basics, just to start off. We've all been hearing a lot about COVID over the last, 18 months or so, but let's just kind of refresh everyone's memory with what is influenza? What is the flu? So let me see. Oh, Sara, take you off mute. Sorry, Sara Warnicki. Can you? There you go.
There we go. Sorry. Yeah, so flu is just another one of the viruses that's out there that is vaccine preventable disease. It's one of those viruses that can cause mild to moderate to severe illness, depending upon who the individual is that would contract the virus, and have a lot of aches and pains, headaches, fever, sore throat, cough, runny nose, a lot of those same symptoms that we see with COVID. The flu virus itself presents maybe a little differently than COVID, and cold and flu, it starts pretty abruptly. It doesn't have those couple of days of lead in to symptoms like cold can or like COVID can. You come down with symptoms a lot more quickly once you've been exposed than what you would with COVID or cold and flu. So
they're both respiratory viruses, right?
Correct.
Right. And there's two different strains of flu, or predominant strains, I guess, rather, that we tend to hear about: flu A and flu B. Is that right?
Correct. So in our flu vaccine, we have protection against 2 flu A strains and 2 flu B strains. Flu A and B are the more common influenzas that we see that circulate in humans.
Okay. Cool. What and so, like you kind of said, the symptoms are fairly similar to respiratory illness. How does it spread? Obviously, the same as like any other respiratory illness. Respiratory droplets, coughing, sneezing, etc.
Correct. So it's spread through droplet transmission. So through coughing, sneezing, in close contact with someone who has flu, coughs or sneezes, and doesn't use proper hygiene, that's how it's transmitted.
Gotcha. What's the treatment for that? Like, we'll talk about prevention and stuff in a minute, but so if someone is diagnosed and they test positive for flu, what's the treatment?
So flu is not curable. It is a virus that has to run its course, which is what we see with viruses. There are some management tools that we use, such as antivirals, and that is according to timing. You have to be diagnosed within a certain window of your symptoms starting for those antivirals to really be helpful. But other than that, it is a virus that runs its course.
Gotcha. When I was doing some research and just kind of looking up like the symptoms and treatment and vaccination and just different information, I literally saw an article that was chicken soup is not a treatment for the flu. But it's kind of funny because I mean, I remember being a kid and like my mom would send me to my grandma's if I was sick, which now knowing vulnerable populations, that probably wasn't the best idea, but my grandma would always give me like Campbell's chicken noodle soup, and it was like, yes, this is happening. And there was a whole article dedicated to like the warm broth might feel good like on a sore throat or for, you know, crummy feeling, but there's actually no scientific proof to show that. So I just kind of thought that was funny. I was hoping you would say chicken noodle soup. That one's funny, but
I'm sorry to disappoint you.
The 90s lied to me. Okay, so let's kind of talk a little bit about flu season in general. These are kind of some epi questions, but when do we typically see flu season and like when do we do our reporting?
Yeah, so flu season officially begins on October 3rd this year. It's always CDC week 40 and it runs all the way to CDC week 20 of the next year. But the dates obviously are changing, you know, depending on the year. This year starts October 3rd and it lasts all the way until mid-May.
Okay.
We actually, and to answer your second part of your question, we do our reporting the entire time. So we'll begin putting out our weekly summary reports when flu season starts the week after, because we want to have a full week's worth of data, but that's when we'll start.
Right. And those are pretty comprehensive reports that you put together. Like we have the data for the county as far as cases and age demographics. And I think we even break it down into flu A versus flu B. My madness. No, I think we, I was going to say, I think we do. And those are on our website. So for people who are super curious or, you know, geeked out by flu data, in addition to the CDC, we have our local county data here on our website. You can find that on the flu section there. What are the predictions for the flu, this year's flu season? Because when you listen to the media or sometimes like you'll see articles where they're predicting, you know, it might look a little different than last year where we didn't see many cases. So what are you thinking? What are you hearing, Sarah?
Yeah, it's definitely going to depend on a few different factors. But because we had a really low flu season last year, we have a lot more susceptible people this year. So there's reduced population immunity to the flu right now. So a lot of experts are saying that this could result in an early peak flu season and possibly a more severe flu season this year. So it all kind of depends. It depends on if people in our community are going to continue using masking and distancing. And it's also going to depend on our vaccine effectiveness and basically the number of people in our community who choose to get the flu vaccine this year.
Right. So kind of speaking along those lines of just prevention and stuff in general, obviously we know that it's a respiratory virus. So a lot of the prevention strategies that we have in place for COVID also kind of benefit us in preventing flu, kind of what you both have already talked about. Obviously, proper hand washing, wearing a mask doesn't hurt because it protects us, helps protect us from COVID, but also now as we enter in flu season, staying home when you're sick is definitely a big one. And then getting vaccinated is another one too. What do we, I guess, what do we know about like the flu vaccines, or how does that whole piece work? They figure out which one's going to work best, and then we kind of put it out into the community.
Yeah, I'll answer that one. So basically the flu predicting and the forecasting, it's all about using different surveillance systems and looking at previous year's data to help us plan ahead for the upcoming flu season. The goal is to reduce the impact of flu. So when it comes to the vaccines and figuring out which viruses are going to be predominant, which flu viruses are going to be predominant, we have certain people who dedicate their work specifically to researching this topic. So we know there's a lot of different flu viruses. They're all constantly changing and mutating. So the composition of the flu vaccines in the US, they're reviewed annually and they're updated to match the circulating flu viruses for the season. So they're all designed to protect against, like this year, for example, the 4 viruses that research indicates are going to be the most common this year.
Gotcha. That was like the easiest and yet most understandable explanation that I've ever had anyone answer to that question. So thank you for that, because that was very clear. I can understand that one. So kind of talking about flu vaccines, should people get vaccinated right now? Is it time for vaccine? Should they be holding off? What do you think?
So now is the perfect time to get your flu vaccine.
Okay.
Ideally, everyone will have their flu vaccine by the end of October.
Perfect. And I know that so we have flu vaccine that we're actually going to be rolling out here very soon, I believe, correct? We've got our flu vaccine in and we're ready to start handing that out.
Correct.
So
we started giving our first doses today.
Oh, okay, perfect. So obviously we can get vaccinated within the health department at our locations. And we also have really great partnerships with some of the school districts in the county where we go out and provide vaccines to the staff and students, which is really great. I always love being a part of that program and getting out into the community and getting that to our folks in a place that's convenient. But there's other places to get vaccinated too. I feel like a lot of the pharmacies provide flu vaccine now. Some of the pharmacies like within grocery stores can provide that, your doctor's office. So there's lots of different spaces to get that.
Those are all the top. Yeah, there are always flu vaccine available at multiple locations.
Right.
Health department, local pharmacies, healthcare providers. If unfortunately you would find yourself hospitalized during this time of year, hospitals administer flu vaccines as well.
Gotcha. So there's a difference too between your regular dose and a high dose. I know this one comes in because I've had some folks ask the difference between, do I get the regular dose? Do I need the high dose? Can you explain that just a little bit about what's recommended for each individual?
Sure. So for 65 and older out, there is what we call the high-dose flu vaccine. It's a little higher of a dose, and it has a little more antigen. And that is to help those individuals build solid protection against flu virus. So it's the same as we've been hearing about COVID vaccines. Folks who are over 65, their immune system may not be 100%. So in building the best protection, we're going to give them more vaccine.
Gotcha. So Sarah was kind of breaking up a little bit there, and I think we lost her, but she may jump back on. But basically, there's a difference between just the regular dose and the high dose. That's meant for our vulnerable populations, usually 65 and older, who can get a little extra protection from a higher dose vaccine. There she is. And okay, so Sarah's going to pop back on for us. But one of the things that we also wanted to chat about just a little bit was talking about some of the common flu myths, because we see a lot of this every flu season that we go into, even conversations I know that I have like with just family members or, friends and things like that, that still have these common flu myths. Sarah, you're back. Yay. So one of the biggest flu myths, or one of the biggest questions that I get during this time of the year is, can you get flu from the vaccine? And the clear answer to that is no.
Right.
Yes.
Correct.
No, you cannot.
Flu vaccine. Correct. Flu vaccine is not a live virus, so it cannot cause death.
Right. She popped up again. But Sarah's not having the greatest luck with that, but she's absolutely correct. It is not a live virus, so you cannot get sick from it. It is an inactivated virus, and sometimes people get, maybe a crummy feeling if they've already been sick, or if maybe they feel a little downtrodden or a little tired after, and sometimes your arm hurts depending on who gives you the vaccine as well. But you cannot get the flu from getting the flu vaccine. It is an inactive virus. So this is one that we've been getting a lot just within the past year. And I've already seen a couple of the questions that have come up kind of on the side here in the chat. Are flu cases counted as COVID, and how can we tell the difference? So Sara, I guess, could you explain that for us for both Sara? Either Sara, that one?
Yes, I can explain that. No, flu cases are not confused with COVID, vice versa. They're completely separate. The way that they are reported to us is completely different. And the way myself and our data analysts calculate those cases and report them to you all in the community is different as well. So there's no chance of them being confused. Even though you yourself may confuse COVID and flu because of the similar symptoms, that's normal. The tests, like when you go to urgent care or the doctor's office, they're highly accurate, specific lab tests that detect the presence of that particular virus. So it knows the difference between the flu and the COVID virus.
Right. And I'm glad you made that clarification, because the symptoms are sometimes very similar. And to, the common folk like myself who don't know the difference between what my sniffles are coming from, but that test does. And so that's why that test is key. And those cases because they come in as test results. So it's not just, I call Sara up and say, hey, I have the sniffles, mark me down as flu or COVID. That's not how it works. You need the actual lab report and the tests. So another one that we get a question a lot, do I have to get the flu shot every year because I just got it last year? The answer is yes. We recommend that you get that every year.
Yes, so as Sara mentioned earlier, the flu vaccine is formulated in a new formula each and every year, depending upon what strains of flu we're seeing circulating. And the typical flu shot will last you 9 to 12 months. And then we have the new formulation for the next year. So it requires a booster every year.
Perfect. So kind of on that case, we've had a couple people, and I know even last year this was a thing where I never get the flu. I've got a pretty strong immune system. I don't need to worry about getting that flu vaccine. What's our recommendation there?
You want me to take this one?
I vote still get the vaccine because
so even healthy young people can get the flu if they're exposed. It's going to keep you from getting sick. It's going to reduce the severity of your illness if you do get sick. But more importantly, the vaccine is going to provide protection for those around you. So those people who have weakened immune systems or those who are too young to get the vaccine, if you have a newborn in your family or friend group, it can be really dangerous for them. So by getting the vaccine, you're possibly saving other people's lives too.
Right. And then this one is one that we've also been getting this year too recently, because they have similar symptoms. The vaccines are not the same. So people are asking, do I need a flu shot if I've already had the COVID vaccine? And to be clear, yes, we recommend the flu vaccine as well as the COVID vaccine because they are two different viruses with two different vaccines. I'm sure you guys can explain that better than I can, but for the most part, that's what it is. We definitely.
Yep, you pretty much hit the nail on the head with that one. Each vaccine is going to target its own specific virus.
Right, for sure. Let me check and see what kind of questions we have really quick. We did have one that came in before. Somebody had said, it seems like there's a lot of illness spreading through our schools. Is there a good way to tell if it's the flu, COVID, the common cold, or allergies? So we kind of touched base a little bit about the flu and COVID have specific tests where if you're feeling symptomatic and you go in, they can test for those two specific things. The common cold and allergies are a little different because those aren't specific tests that we can do. But they asked, when should we call a doctor and get a test? And I think we were kind of talking about this before, nursing Sara, about how if you're feeling symptoms, you should be looking into that and probably staying away from other individuals until you know for sure what you're dealing with, right?
Correct. So the take home with that is if you are feeling sick and you have any of flu related or COVID related symptoms, you need to stay home to try to stop the spread. Checking in with your healthcare provider is very important. If you go to CDC, they do a really good job of differentiating between cold versus allergy versus flu and COVID, and comparing symptoms, reaching out to your doctor to talk about options. If you're falling to where those symptoms are more in the flu category, reaching out within 48 hours to your healthcare provider to where if those antivirals would be appropriate in your case, they could be prescribed.
Perfect. Yeah, that was the other one that we had come in. Let me check and see if we have any other questions. Oops, sorry. So it doesn't look like we had any other questions. Somebody had mentioned, like, how do we predict a virus? But Sara, we kind of already alluded to that they look at like data and surveillance trends and things like that to see what we think. And again, just to reiterate, a vaccine is a vaccine. So it's meant to help. It's not a 100%, but it's definitely one of the gold standards that we have for prevention, especially with respiratory illness. So it's definitely something that we recommend. And kind of like we talked about before, it's prime time and ready to go. So if you've got the opportunity to get that flu vaccine, now is a good time. And definitely, I think, Sara, you said we recommend by the end of October that folks be vaccinated. Yeah.
Ideally, being vaccinated by the end of October is how we like to see things go. But it is never too late to vaccinate. Historically, we see the peak of flu about February. So even if it is after October and you haven't gotten your flu shot, it's not too late.
Yeah, that's a really great point. I'm glad you put that out there, because it's definitely better late than never kind of situation for that. So I'm looking through the chat and the comments. It doesn't look like we had any other additional questions. So we'll go ahead and wrap up for this evening. There's lots of flu information, obviously, on the CDC website. We have some as well on our website. There's a whole section for flu information. And there's some great information there that we had discussed about the difference between flu and COVID, as well as whether it's a cold or allergies. And then in addition to that, once we start putting out this season's weekly flu report, those will be there as well. And you can always look back at our previous year flu reports. So if you have any questions in regards to flu, COVID, or anything else health department related, you can always reach out to us on social media or communications@jeffcohealth.org. We're happy to answer your questions. As well, if you are ready to be vaccinated, or anyone in your family is ready to be vaccinated against flu, give us a call, 636-797-3737. We'll set you up for an appointment and we'll get you taken care of. Until our next episode, I hope everyone stays safe and healthy and has a good evening. Thanks again, ladies, for joining me.